Hi, it's Sylvester, and I'm going to answer some questions about being trans. I'm getting these questions from transequality.org. First question is, have you had any surgeries? I had chest masculinization surgery on January 13th of 2023. It was Friday the 13th, and I have a video talking about my experience having chest surgery. Just so you know, I'm a bit of a downer in that video because my chest surgery journey was difficult. The surgery itself went pretty well, but the aftermath of the surgery was difficult for me to get through. I was pretty much all alone, and I was suffering with mental health problems, and it was just a very dark time in my life. But that being said, I do not regret the surgery in any way. I'm very happy that I got it because I do believe that it was necessary and potentially life-saving. What did the surgery cost? It was free because I live in Ontario and the Ontario Health Insurance Program covered it, and I'm very thankful for that. I know there are a lot of trans people in the world who are unable to access the surgeries they need, and a lot of trans people who go into debt and pay a lot of money to have the surgeries that they need, and I'm very lucky that mine was covered by the government. I had a friend ask me the day before my surgery if my surgery was going to be covered because it's a cosmetic surgery, and that offended me because I felt like they were implying that my surgery wasn't important enough to be covered by the government. But I do think my surgery was very important. Even though it is technically cosmetic, I didn't see it as cosmetic. I saw it as a necessary treatment for my gender dysphoria. And so it was an important surgery, and I did need it, and I'm very grateful that I was able to get it and didn't have to pay for it. I had to fight very hard to get the surgery, and I had to wait 4 years before I was able to access it, but I was able to access it, and again, I'm very lucky compared to a lot of trans people out there. And I also want to point out that not all trans people want or need surgeries. There are plenty of trans people out there who do not require surgeries to treat their gender dysphoria, and there are plenty of trans people out there who could benefit from surgery and it could treat their gender dysphoria, but they just don't want surgery for whatever reason, or they can't have surgery for health reasons or whatever. And so not all trans people are going to have surgery, and not all trans people want or need surgery. Next question. What does hormone therapy do? I'm on testosterone. I put a needle in my leg every week, every Monday. It's not a very pleasant experience, but it's necessary to treat my gender dysphoria. And testosterone has done a lot for me. It has caused me to grow thicker and more body hair and facial hair. I did have a little bit of body hair and facial hair before I transitioned. I had a bit of a mustache and some chin hair that I would shave off, and I had lower back hair, but now I have like full body hair. My whole body is just covered in body hair, and I'm able to grow an actual beard. I am a little disappointed. I was hoping I'd be able to grow a thicker, fuller beard. It's a little bit sparse for my taste, but it's still a beard, and I'm grateful for that. It caused my voice to get deeper. It caused me to have increased muscle mass. It caused the fat in my body to redistribute. It caused me to stop menstruating, which I'm very thankful for, not only because menstruation is just a very unpleasant experience all around, but also because menstruation caused me to have gender dysphoria. A lot of people who were assigned female at birth are jealous of me because I don't have to menstruate anymore, and I just want to point out that it's not just that I need to be on testosterone to stop my period because periods are unpleasant, but it's also because periods cause me a significant amount of mental distress because of my gender dysphoria. But that being said, periods are just kind of unpleasant. I mean, menstrual pain is awful. Menstrual cramps is a pain that I wouldn't wish upon my worst enemy. A lot of people with penises don't believe us when we say it's really painful. They think we're being dramatic or we're exaggerating, but I promise you, menstrual cramps are extraordinarily painful. You don't stop your period right away when you go on testosterone. Most people will have their period for a couple more months before it goes away. I had 3 periods before mine ended, and I actually wrote down the day when I had my last period. The last day of my last period after starting testosterone was on February 2nd of 2019. And again, I had 3 periods before it ended. Next question. Are children too young to know their gender? No, absolutely not. There are many children and many young people who realize that they're transgender, and unfortunately there are a lot of laws that people are trying to put into place and have already put into place that prevent young people from accessing trans health care, which is absolutely not acceptable. I in some way I envy people who realize they're trans at a young age, because it took me so long to realize that I was trans. I was 26 or something when I finally was able to come out as trans, and finally was able to feel comfortable identifying as my true gender. But again, I know that a lot of young people are being prevented from accessing the health care that they need, and that is truly unacceptable. Are transgender people confused or going through a phase? No, it is not a phase. Some people detransition, but those are the minority. What was your birth name? You should never ask a trans person what their birth name was, but just so you know, my birth name was Stephanie Ann. If you don't know, Alexander is my middle name, so Sylvester is first name, Alexander is middle name. I don't generally give out my last name on the internet, but my birth name was Stephanie Ann. And fun story, which has nothing to do with me being trans, my name has actually changed twice in my life, because when I was born, it was Stephanie first name, Ann middle name. But then I lost my birth certificate in 2013 because I was kidnapped and it was stolen from me, and so I had to get a new birth certificate, and at some point somebody made an error and my name became hyphenated, so it became Stephanie Ann hyphenated, and I lost my middle name. So my first name was Stephanie Ann and I had no middle name. So again, my name has changed twice in my lifetime. I went with Sylvester because it has the same number of syllables and the same number of letters as Stephanie, and for some reason that was important to me. I was going to go with Sebastian, but I decided to go with Sylvester, obviously. A lot of people call me Sebastian, though, for some reason. I look like a Sebastian. Yeah, I went with Sylvester because it has the same number of letters. Next question is, can I see photos of you from before you transitioned? Again, you should never ask a trans person to see photos of them before they transitioned, but if you want to see photos of me before I transitioned, I literally just made a video where I show a bunch of photos from throughout my life, from childhood to today. So I'll link that video in the top right corner if you want to see what I look like before I transitioned. What bathroom do you use? I use the men's room. Unfortunately, there are a lot of people trying to make it illegal for trans people to use the proper bathroom. And personally, I would really hate it if I had to use the women's washroom, because I don't feel like I belong in the women's washroom, but that's what people are trying to make happen, and that's very unfortunate. Trans people should be able to use the bathroom that aligns with their gender identity. Do you regret transitioning? No, not at all. If anything, I regret waiting so long to come out as trans, because I kind of knew that I was trans for a while before I came out. I just kind of was questioning it, and I confused, and I didn't really know, am I a man, or I don't know. It took me a long time to realize that I was a man, and so I kind of wish that I had figured it out earlier. Then I could have spent more time experiencing life as a man. I've technically always been a man, but I feel like I experienced life as a woman for most of my life. I feel like I never got a chance to be a little boy, and I never got a chance to be a teenage boy, and I never got a chance to be a man in my early 20s, and so I feel like I missed out on a lot. How can you tell if someone is transgender? You should never try to guess if somebody's transgender. If you look at somebody and you think that's a transgendered person, keep your mouth shut, because a lot of trans people want to be able to pass. Not all trans people want to pass, but for a lot of us, we want to be able to pass as the gender we identify as. And so if you look at a trans person and you know that they're trans, just don't be a dick. Keep your mouth shut about it. What's the difference between a transgender woman and a drag queen? A trans woman is a person who identifies as a woman who is assigned male at birth, and a drag queen is somebody who can identify as any gender who likes to perform in a certain way. Again, some drag queens are transgendered women. Lots of drag queens are people who identify as women, but a transgender woman is specifically a woman who is assigned male at birth. Why do there seem to be more trans people now? Because it's more acceptable now than it ever has been in any other time in history. Is being trans a new thing? No, there's been trans people all throughout history. It's just that most of the time they were forced to hide their trans identity, or they were just straight up killed or punished for being trans. With whom do trans people have sex? Well, with whomever they decide to have sex with. It's, not that different from how regular people have sex, regular cisgendered people have sex. It's just, if there's a person you want to have sex with and they want to have sex with you too, then you have sex. It's really not that difficult. How do you have sex? Again, you should never ask a trans person that, but I have sex basically the same way most people have sex. Sometimes, I don't really have sex. I'm asexual, so I don't really enjoy sex, but if I were to have sex, sometimes I'd put on a strap-on and, penetrate, and sometimes I would be penetrated, whether that be vaginally or anally, or whether it's oral sex. It's I have sex the same way everybody else has sex. I just, it's really not that complicated either. Are you sure you're not just gay? Yes, I'm sure. There is a difference between being a butch woman or a very masculine woman and being a trans man. A masculine woman is somebody who identifies as a woman who is masculine. A trans person or a trans man is somebody who identifies as a man who could be masculine or could be feminine. I'm rather feminine for a man. So no, I'm not just a really masculine woman. I am somebody who identifies as a man. And that is all. Those are all the questions. So thank you for watching. Have a great day. Stay frosty. Bye.